Hello. After completing the maxillary central and maxillary lateral, we are now ready to go on to the mandibular counterparts. The mandibular central incisor is the smallest tooth that is present in the oral cavity as a whole. More importantly, it is one of the tooth that shows least variations in the oral cavity. They are also known as the smallest permanent teeth. Here we will be dealing with 3-1 and 4-1. The central incisor in the third quadrant, which is the mandibular quadrant, and the 4-1, which is also a part of the mandibular area. If you look at the universal number system, the right mandibular central incisor is number 25 and the left mandibular central incisor is number 24. So, in this sort of condition, let us go on to understand the differences with the maxillary, which I shall repeat again. The maxillary central incisor is the largest tooth mesiodistal widthwise, and it is much larger when compared to the maxillary lateral incisor as well as the mandibular central and lateral incisors. When compared with each other, the mandibular lateral incisor is the larger tooth when compared to the mandibular central incisor. These incisors resemble each other in many ways, especially at the incisor-cervical, mesiodistal, as well as at the cemento-enamel junction. When we come to the general characteristics, this is adjacent to the lateral incisors that are present. So, mesially they border each other and laterally they are bordered by the corresponding lateral incisors. They share mesial contact areas with each other and share distal contact areas therefore with the mandibular lateral incisor. The mandibular central incisor normally has the lowest mesiodistal dimension with respect to any single tooth that is present in the oral cavity. Quite simply, it is the smallest tooth that is present in the oral cavity. The crown is quite symmetrical. Also, it is used in the functions that I mentioned earlier. It is used in mastication, phonetics, as well as for aesthetic purposes as well. When we come to the developmental table, the initiation of calcification happens at 3 to 4 months, following which the enamel has to be completed. This happens in about 4 to 5 years, following which the tooth erupts in the oral cavity at 6 to 7 years, followed by completion of the root at 9 years. Therefore, the mandibular central incisor along with the first molars will be the first few teeth that erupt in the oral cavity. If you can note, the eruption time is at 6 to 7 years, approximately at the same time as the maxillary and mandibular first molars. So, initiation of calcification happens 3 to 4 months. The completion of the enamel happens at 4 to 5 years. The eruption happens at 6 to 7 years, and the completion of the root occurs at 9 years. Now that we are done with almost all the general aspects of the mandibular central incisor, let us look at each of the aspects. First one's in the vertical axis, the labial aspect of the mandibular central incisor. So, this is the mandibular central incisor, this is the mesial side, this is the distal side. If you look at the mesial side, it gradually tapers in nearly a straight line. Similarly, the mesio-incisal angle is also sharp. Therefore, the mesial ridge comes out in a straight line and the mesio-incisal angle is sharp. Quite sharp when compared to the mesio-incisal angles of the other teeth. The height of contour will be at the incisal third. That means the area where it becomes convex will be approximately at the incisal third. If you look at the distal margin, you look at the distal margin, it is also straight. It is also straight. And look at it. It exactly borders the mesial outline. This has not been seen in the maxillary incisors, which is why the mandibular central incisor is considered the most symmetrical tooth that is present in the oral cavity. Similarly, when it meets the incisal ridge, you find the same sharp disto-incisal angle. Therefore, the distal ridge is also straight and the disto-incisal angle will be sharp. This is the incisal ridge. Therefore, you can see that the height of contour will also be at the incisal third. Therefore, mandibular central incisor is very easy to understand. They are symmetrical carbon copies of each other. The mesial ridge is going to be straight. It means the incisal ridge at a sharp angle. Therefore, the mesio-incisal angle is sharp. The distal ridge is also straight. It meets the incisal ridge at the disto-incisal angle, which is sharp. Both evenly taper towards the gingiva. Now we come to the cervical outline. The cervical outline again is symmetrically curved. It exhibits great symmetry. Therefore, symmetrically curved. Incisal outline, if you see, you will find the appearance of mamelons in newly erupted teeth. Mamelons are noted in newly erupted teeth, but when it comes to wear and tear and function, and while biting with the maxillary central incisors, normal tear will lead it to become straight edged again. Therefore, mamelons disappear and the edge becomes straight. As you see in this condition, the edge becomes straight. The labial surface will be gradually convex. The labial surface is gradually convex and it is not as convex as the maxillary lateral. Therefore, this is a much flatter tooth when compared to the mandibular lateral incisor. Eventually, you will also realize that the cusp is almost trapezoidal. The shape of the crown is almost trapezoidal. This is the entire aspect of the mandibular central incisor. So, in review, marginal ridge straight, mesial, distal marginal ridge is also straight. They meet sharply at the mesio-incisal angle and the disto-incisal angle. These are both sharp. The CEJ is symmetrical. The crown is labially convex, and you will see the presence of mamelons in newly erupted teeth, during where it is going to straighten out, and finally they are entirely symmetrical, which means that when you divide it along the long axis of the tooth, you are going to find perfect harmonious symmetry in between both the teeth. This is the labial aspect. In certain rare conditions, the trapezoid can also change and become rectangular in shape. This is also considered to be okay. The height of contour is going to be at the cervical third because the convexity's maximum amount will be at the cervical third. I hope you have understood the labial aspect of the mandibular central incisor quite clearly. Now we shall move on to the lingual aspect. The lingual aspect. There is nothing much to say in the lingual aspect except for the fact that the mesial, distal, as well as the incisal are exactly the same as that of the labial. Why? Because we have already told you that the mandibular central incisor exhibits extreme amounts of symmetry. Therefore, marginal ridge of the mesial is straight, distal marginal ridge is straight, mesial and disto-incisal angles are going to be sharp, CJ is going to be symmetrical, but the CJ is going to be symmetrical. There will be exhibiting of mamelons on the incisal surface. More importantly, the CJ in the lingual curves evenly towards the root, therefore exhibiting the same properties of the labial aspect. Another thing is that you might see, like in the maxillary, a slight concavity. And this concavity is your lingual fossa. Above it, you're going to find your small amount of convexity, and this area is called the cingulum. This is the cingulum. There are indistinct marginal grooves. Remember, in the maxillary it was quite distinct. Here there are indistinct marginal grooves, incisal grooves, no fits, no fissures, no pits that are present on the lingual surface. The height of contour will again be at the cervical third of the tooth. Therefore, in retrospect, when you review it, you have the cingulum, you have a not so prominent lingual fossa, and irreverent amounts of the mesial marginal ridge, incisal ridge, as well as the distal marginal ridge. CJ is contoured, bilaterally symmetrical, and it's almost rectangular in shape. When we come to the mesial aspect, we are going to find a few important things. The labial margins are going to be quite convex, but not as convex as the maxillary incisor. You can have it in two forms. One, it can be convex, or second, it can be straight. So these are the variations that can exist in the mesial half of the tooth. So it is going to be convex only at the level of the gingival third. If it is a straight outline, the convexity will be only at the level of the gingival third. So there are two varieties of tooth. One can be very convex, one can be straight and convex only at the gingival third. Okay, the lingual outline. The lingual outline is concave on the initial two thirds and follows its convex form as you come towards the gingival third. Yes, it is concave at the incisal two thirds and it comes down in and becomes more convex as you approach the cemento-enamel junction at the level of the cervical third. The incisal edge, if you see, has an inclination. The incisal edge has an inclination, and the inclination will be towards the labial. The inclination will be towards the labial side. The cervical margin is much more marked. Yes, the margin is much more marked, and it is an even curvature. It is an even curvature. Now, the surface of the crown here, like your maxillary counterpart, is therefore roughly triangular. What is also more important to note is an offset. If you look at the long axis of the tooth, you will be able to appreciate that the tip is more offset towards the lingual side. The tip of the tooth is much more offset towards the lingual side. This is the mesial aspect of the mandibular central incisor. Now that that's done, we move on to the distal aspect. The distal aspect is more similar to the mesial. The only difference is that the convex curve is going to be slightly less. The convex curve is going to be slightly less in both the labial surface as well as the lingual surface. The contact area including will be symmetrical. Therefore, we understand that in all surfaces, perfect symmetry of the mandibular central incisor exists. Coming to the incisal aspect. The most notable features is the symmetry in the mesial as well as distal portion. The mesial and distal portion are symmetrical. Secondly, you will be able to appreciate the presence of a straight incisal edge. The incisal edge is relatively straight, which makes the entire tooth roughly four-sided. Roughly four-sided. Sometimes they may also appear as a diamond shape also. See, I have converted it into a diamond shape. Therefore, it can be a four-sided rhomboid or a five-sided diamond. Also, the next thing is that when you draw the long axis, you will notice that the crown is more offset towards the lingual. The crown encroaches the midline area and the crown is more offset towards the lingual. Therefore, everything that you scrutinize in this particular aspect is going to be symmetrical, more curved in towards the lingual, because the convexity that is present on the labial surface and the mesial surface makes the crown appear as if it is tilted inwards towards the lingual. The final aspect that we have to deal with the mandibular central incisor is the root portion. The root usually is normally single and straight with the usual conical pattern that is being followed. So you can see here that the root is nice and conical. It is symmetrical all along the long axis of the tooth. Also, it gradually starts tapering. If you observe this, the tooth gradually starts tapering and eventually it is going to end in a sharp apex. It has gradually tapered and it has ended up in a sharp apex. Therefore, from the mesial and the distal aspect, if you look at the root, it is going to be a slight convexity. There's a slight convexity that you're going to see cervico-apically, and even that is symmetrical on both sides. Usually, at the portion of the mesial and distal, there might be a slight flattening at the level of the middle third. This slight flattening can also appear as a root concavity in some mandibular central incisors. And this root concavity here is called the longitudinal groove. It's called the longitudinal groove. When you take a cross section of this tooth over here, when you take a cross section of this tooth, you will appreciate that the cross section is roughly rectangular. Okay, it is not only just rectangular, it is rectangular with rounded corners. So the appearance is going to be like a oval. It is a rounded tooth with a rounded rectangle with rounded corners. So the access point will always be at the center, and if you have an infection from this root, there is going to be a straight pathway downwards that enters into the periapical area. It's a sharp tooth bounded by very dense mandibular bone. Therefore, any lesion over here will show exaggerated amount of pain on vertical percussions. The last thing that we have to deal with is the variations and the anomalies. The variation usually occurs only in the lingual surface. Okay, and that will usually occur depending on the convexity differences that occur in the level of the cingulum. Other than that, the anatomical variations that can be found in the mandibular central incisor is very, very rare. Yes, occasionally you might be able to see bifurcated roots. Other than that, there are not many anomalies that can be seen in the mandibular central incisor. So, the key word about mandibular central incisor is symmetry. It's going to be symmetrical, it is going to be sharp, it is going to look equal on all aspects. The convexities of the cement enamel junction is going to be equal. The root tip is going to be sharp. There is going to be a single point of entry which will be at the level of the lingual fossa, at the level of the lingual pit, just below the cingulum, and the mandibular central incisor will be symmetrical. Now that we are done with this, we are very close to getting over with the mandibular anterior teeth. We are now going to do mandibular lateral incisor next. Thank you.